President Cyril Ramaphosa has reiterated calls for investment in the health and rights of women, children and adolescents. Ramaphosa was in Japan addressing the United Nations Population Fund and Global Leaders Network dialogue on investing in peace. Joining us now is Dr. Lwazi, Manzi, head of the Secretariat of the Global Leaders Network for Women, Children and Adolescent Health. Dr. Lwazi, good to have you, and thank you very much for coming on this afternoon. Your network is, I suppose, one of its kind in the global south, it is said, and part of the work that you need to be doing, of course, is to get commitment from all these 10 or so head of state that are signed up to this initiative. Talk to me about what justifies your existence, in 2025.
Well, thank you so much for having us, and good evening, very late evening from Japan. And I want to first say a huge thank you to the government of Japan, because when we asked to come and talk about the Global Leaders Network here on the margins of TCAD, they actually pulled all the stops to ensure that we were able to showcase the work that we are doing and able to bring together leaders behind this very, very important cause. So, Thabo, thank you for having me. The Global Leaders Network is a coalition of 11 sitting heads of state. Most of them are from Africa. There's one from the EU, and we are still expanding this network. The reason why this network is relevant in this day and age is because although we are making really good progress in terms of maternal mortality, neonatal mortality, and adolescent mortality, we are way off our targets to reach the Sustainable Development Goals for women's, children's, and adolescents' health. Women, children, and adolescents are 70% of the world's population. If we don't get it right with women, children, and adolescents, we're not going to make a dent in attaining universal health coverage and ensuring that we secure good health for everybody. Yeah. And just to give you a sense of where we're sitting and where we're going as the world, we recently heard from the World Health Organization as well as other partners that between 2000 and 2023, maternal mortality fell between 328 and 197. And just to give you a sense of where South Africa is, we're not doing too badly. We're actually at 109, and this is per 100,000 live births. But our target, which is the 2030 targets, which is only now essentially just over 4 years away, is 70. So we need to drop from 197 worldwide to 70. Now, how are we going to do this? A lot of the problems that are contributing to us not being able to attain these targets, we are finding that they're now not actually sitting within health. They sit outside of health. We're talking here about roads and transportation, women being unable to access essential health care on time. We're talking here about health commodities, sexual reproductive health commodities. We're talking about manufacturing of these things in Africa. They're not being manufactured in Africa, and we don't have access to them. And also in the global south, there are those issues. We're talking here about technologies like ultrasounds and all sorts of other life-saving technologies that you need for women and for children and for adolescents, and especially for those women who are trying to access antenatal care. We're talking here about the pushback against sexual reproductive health rights. Just 2 years ago, we had Roe versus Wade. I'm sure many of us have even forgotten about that. And since then, there have been many, many problems that continue to manifest in a pushback against sexual reproductive health rights. Now, you see, Thabo, all of these problems, they require a whole of society and a whole of government approach. And this is why it becomes essential for us to actually maintain these issues at the heads of state and government level, because it's the heads of state and government that can bring together members of cabinet, the private sector, and all the stakeholders that are required to build the right roads, to ensure that we get the commodities manufactured in regions where they're not being manufactured, to ensure that we combat the issues of the rollbacks of sexual reproductive health rights, so that we do have a chance of actually attaining these targets in 2030.
Now, the president says every avoidable death represents a policy and administrative failure. Now, I suppose they're also referring to policies around universal health care, one that is certainly receiving a lot of pushback here in South Africa at this particular point, even though the government is pushing ahead with it. Are we far behind from a global point of view as far as those policies are concerned when you're looking at it from where you're sitting?
I'm sorry, Taba, I did miss a little bit of what you said, but I think I heard you talking about the issue of universal health coverage and the policies that are really essential insurance, right? Now, it's so nice to actually sometimes step outside of your own country situation and witness another country in the way that they are able to actually implement their policies. And Japan is one of those countries where one is able to actually witness the benefits of universal health coverage and to hear from the policymakers in this country how universal health coverage has actually been a cornerstone of their economic development. We heard actually during the side event yesterday and also as in other side events that Japan achieved universal health coverage in 1961 and that they actually implemented universal health coverage not when rich, but when they were really in the doldrums with their economy after the Second World War. They were really very, very poor. But they made a conscious decision that health was going to be a priority and that the state was going to have to finance healthcare to ensure that the population is actually able to be healthy and to be productive. And when you listen to the Japanese, they will tell you that they are not rich. They weren't rich first before they implemented universal health coverage, but they became rich. I'm now actually taking the words that they used. They became rich because of universal health coverage. And one of the things that I noticed while I'm here, a lot of us have heard that Japan, has an aging population. And when you imagine it at home, you kind of imagine, old people lying in bed and the state having to finance their upkeep. But in fact, when being here, I'm seeing the older people are walking around, enjoying their lives, living their best lives, spending money in the economy and being actually economically active. And this is when it's now dawned upon me that the issue of universal health coverage truly is an economic issue. We are seeing now that people live longer and they live healthier lives and they're economically more active. In Japan, they've even increased the age of retirement to 70, which means that you are getting 5 years out of each and every citizen of productivity and therefore economic activity. Now, where it matters with women, children, and adolescents' health is that Japan at the moment, because of their experience, have decided to establish something that is called the UHC Knowledge Hub, and they're launching it this year. And we issued a clarion call through the president as well as the other JLN members that joined us, that was Nigeria and Ethiopia and the other African countries that were part of this event, to say to Japan, while we are learning from you, please make sure that you place women, children, adolescents at the center of these policy reforms. Because we know that if we can make a dent in this population group, these are population groups that actually represent future generation productivity and economic activity. If we can get more healthy years out of these population groups, that surely would represent, and of course, the modeling and the evidence. You can go through any document from institutions like the World Bank. It will show you that indeed, if you get more productive years out of people, then your economy will be built up and you will be able to develop going forward. And this, for us, was the clarion call that we issued to the government of Japan. And because we were also addressing parliamentarians and we were addressing the business community as well, which has really pulled together here in Japan in support of Africa and women, children, and adolescents' health, particularly in this particular environment where the geopolitics has led to withdrawals in ODA. This was a very, very essential political call that we had to issue to all of the stakeholders for us to all enter into a regime where we are in solidarity behind universal health coverage for women's, children's, and adolescents' health to ensure that we are able to cushion each other against these geopolitical forces that have caused this upheaval in global health financing.
Yeah. What is the investment case that you've made, I suppose, that supports the notion that every dollar spent in this particular sector yields a return on investment?
The investment case, Itabo, is actually very simple. We know what the cost of inaction is. The cost of inaction, if you are unable to protect mothers, to protect children, and to protect adolescents, is that you essentially lose out entirely on the economic potential of these groups. McKinsey very recently produced a report, for example, that we lose $1 trillion if we do not actually close the health gap between women and men. The health gap between women and men talks about the years that are lost by women who find themselves in ill health compared to men. And they showed us that we do indeed lose $1 trillion. If we do not invest in adolescents, we also lose hundreds of billions of dollars in productivity out of those adolescents in their adolescent years. We're not even talking about them being productive in their adult years. And of course, if we are seeing adolescents dying or being maimed from preventable diseases, that is actually a burden to the fiscus, whereas we should actually be getting productivity out of these adolescents.
Dr. Lwazi, as always, much appreciated. Thanks so much for coming on. Dr. Lwazi Manzi, head of the Secretariat of the Global Leaders Network for Women, Children and Adolescent Health.